Joining me now is Dr. Rob Davidson, an ER physician and executive director of the Committee to Protect Medicare, and Dr. Tamara Moise, also an ER physician and co-founder of Big Apple Urgent Care. Thank you both for being here. I'll go in reverse order. And Dr. Moise, the WHO, the World Health Organization, sees welcome slowing of COVID-19 cases, but warns against lifting restrictions too soon. Just a little bit of this. The WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly, WHO Director General Tedros Adhanom Ghebreyesus said. Your thoughts on whether or not seeing a plateau, as we're seeing in New York, means it's time to reverse and let up on social distancing?
I 100% agree that we must definitely continue our social distancing. We can't let go right now. We are still at a point where we still have a very high number of hospitalizations, although the rate of hospitalizations are going down, but we still have a lot. And we still have to continue the social distancing and the good hygiene. If we stop now and if we revert back to our normal way of life, we can see a second surge, a second surge in a high number of corona cases again. So we really have to make sure that we don't get comfortable, although we're doing a great job. A lot of people are social distancing and it's really helping, but we definitely have to continue the fight. We have to continue because it is working, but we're still not ready. We're not ready to go back to where we were before.
Yeah, indeed. And I can't see, Dr. Davidson, how we can possibly do that if we're not mass testing. This confounds me. Here is the President of the United States having an interaction with reporter Jim Acosta on that very question of whether we need nationwide testing. Take a listen.
How could the administration discuss the possibility of reopening the country when the administration does not have an adequate nationwide testing system for this virus? Don't you need a nationwide testing system for the virus before you reopen?
We have a great testing system.
Don't you need that, though, Mr. President, to make sure people are safe going back to work? You don't want to send people back to the workplace.
We want to have it, and we're going to see if we have it. Do you need it? No. Is it a nice thing to do? Yes. We're talking about 325 million people, and that's not going to happen, as you can imagine, and it would never happen with anyone else either.
Your thoughts, Dr. Davidson. Donald Trump says we don't need it. We don't need a nationwide testing system. It'd be nice, but we don't need it. Your thoughts?
Yeah, I just worked last night in a rural ER in Michigan and admitted 2 very sick patients with COVID-19, sent home another 3 or 4 without testing the ones I sent home because they didn't fit the criteria. So we still don't know, and I think there is no way on earth we can do this safely without massive testing, without antibody testing. Our governor here just re-upped our shelter-in-place order to the end of April, and the State House leader and State Senate leader, who are Republicans here, attacked her on social media. Now we have 200,000 people in a Facebook group who are coming out against this quarantine and are organizing a march in Lansing. The last thing we need, a month from now, the people from that march are going to start showing up in hospitals and add to the statistics. And it's just criminal that the president isn't leading on this.
Yeah, I mean, this is one of the big worries about today, right? That people would decide to go and show up in church today and do Easter services, and that then you would have another, cohorts of church attendees that then become another cluster of COVID-19 cases. Zeke Emanuel commented on this, Dr. Moise, and there's a New York Times piece entitled "Restarting America Means People Will Die, So When Do We Do It?" According to Zeke Emanuel, one of the 5 experts who was asked to weigh in on this, larger gatherings, he says, conferences, concerts, sporting events, when people say they're going to reschedule this conference or graduation event for October 2020, I have no idea how they think that's a plausible possibility. I think those things will be the last to return. Realistically, we're talking fall 2021 at the earliest. Do you agree with Dr. Emanuel, Zeke Emanuel?
It's tough to swallow, but it is a possibility. But I think right now it's still really difficult to put a date on it. I think we have to just take it day by day, make sure that we're continuing our social distancing practices and, continue to follow all of the data and then make a decision from there. But it's really difficult to put a date on this right now. It's very early.
Yeah. Let me play Dr. Anthony Fauci, the expert that Donald Trump doesn't always listen to. And here he is when he makes a point that I think seems like sort of obvious, which is that if we lift restrictions, then we'll see more cases. There's no doubt about that in his mind. Take a listen.
Don't let anyone get any false ideas that when we decide at a proper time when we're going to be relaxing some of the restrictions, there's no doubt you're going to see cases. I would be so surprised if we did not see cases. The question is how you respond to them.
And so, Dr. Davidson, if that happens, restrictions get lifted, you see more cases, doesn't that just start the pandemic up again? I don't know how you end it if you're not testing and then lifting restrictions. I know it's repetitive, but isn't it true that if, let's say, we think it goes away, then we lift restrictions, and then we see more cases, does that just start the pandemic up again?
Absolutely. If the only data points we have are hospitalizations and deaths, then we're going to be playing pandemic whack-a-mole for the next year and a half. If we have actual tests, antibody tests, tests of active infection, and we use that data to drive decision-making on who can go back to work, who can go back to sort of semi-normal life, that is the only way we're going to minimize these little hotspots that'll be popping up for the next year and a half. And in my hospital, we don't expect our peak to be until early June, as it stands right now. So we can't possibly do this without having the data.
Yeah, indeed. Hopefully somebody that works near the White House will hear that and maybe tell Donald Trump that. Who knows? Dr. Rob Davidson, Dr. Tamara Moise, thank you both. Stay safe. Really appreciate your time.